cannula, and I will be administering oxygen to my patient. I'm also going to be going through all the different kinds of masks that we have as well. First, I would knock, introduce myself, and get 2 patient identifiers, name, date of birth, have them repeat it back to me, perform hand hygiene, and I would don gloves. I have a doctor's orders to apply oxygen, and depending on what type of order it is that the doctor wrote would depend on what type of mask I would use. So the first type of oxygen delivery system that we have is called a nasal cannula. To apply the nasal cannula, these 2 pieces right here would be inserted into the patient's nose with the 2 tips facing back. Apply it into the nose, and I want to wrap that around the patient's ears. Okay. And then you would pull up on this to make sure that it was snug around their ears. Now, for this patient, things to look for with the nasal cannula is skin integrity. You want to make sure that there's no redness around the nose. Also, any discomfort that's behind the ears, you can use gauze, place it behind the patient's ears, and then put the tubing around. You want to make sure that you're assessing if the patient's nostrils are getting red. If that's the case, then you can apply ointment. Also, you want to make sure that you clean the nasal cannula every 8 hours. From there, this also delivers up to 6 liters of oxygen. Next, we have a regular face mask. To apply this one, you would place the mask over the patient's nose and place the strap behind their head, making sure that the mask is on securely. This system would deliver up to 10 liters of oxygen. Okay. The next system that I have is a partial or full rebreather. This system applies the same way over the patient's nose and mouth and behind the patient's head. Now, when you turn the oxygen on, you want to make sure that this bag inflates almost all the way and it stays inflated the entire time. This allows for the patient to get, if it's a full rebreather, 100% oxygen. So all they're breathing in is oxygen, all they're breathing out is oxygen. If you wanted to make it a partial rebreather, you would remove these little tabs here, and the patient would be able to breathe some of that CO2. Next, we have a face tent. This kind of mask is applied to patients that are claustrophobic. This would rest on the patient's chin, and strap would be put behind the patient's head. You would pull these straps tight, and the oxygen would be delivered, and the patient would just breathe in the oxygen. The oxygen would just kind of blow in the patient's face. This delivers, don't really know exactly how much this delivers because it's open, 10 to 15 liters, along with the rebreather and partial rebreather. Next, we have a specific oxygen delivery mask. This mask is also applied the same way, over the face and mouth, behind the head with the strap. And for this particular oxygen delivery system, it comes with a bag with all different kinds of oxygen delivery things, and this one in particular is 31% oxygen at 6 liters per minute. And they come with all different kinds. And you would just place it inside there, hook that in, connect the oxygen. And the last system that we have is a nebulizer. This is to deliver medication. This piece would detach. You would place the medication into this part, reattach, and then the patient would be able to breathe in the medicine along with the O2 at the same time. This kind of humidifies the medicine. I would assess the patient every few hours to make sure that the patient was comfortable, that it wasn't, that the O2 wasn't too dry. If the oxygen was dry, I would attach a humidifier, which you can see in this system right here. It is sterile water that attaches to the bottom of the oxygen delivery system, and what it does is it vents in water to allow the air to be not as dry, because sometimes oxygen dries the patients out. I would, like I said, reassess the patient. By doing that, I would perform a full respiratory assessment, respiratory rate, check to make sure that their breathing is not abnormal, that they're breathing normal, not heavy breathing. Oh, and then also with the nasal cannula, I would try to make sure that the patient breathed through his nose and out through his mouth to get that full oxygen delivery. And that includes my assessment. Thank you.